We welcome Mr. Huey Cadette, the Assistant Secretary for the Division of Health and Social Services, and also the Chairman of the Steering Committee for the Health Centers, Mr. Huey Cadette.
Good morning. Thank you, Mr. Master of Ceremonies. Let me, of course, first recognize the Honorable Chief Secretary, Mr. Over London, other secretaries, assistant secretaries, and members of the Tobago House Assembly, Mr. Casey Roberts, representing the Honorable Minister for Tobago Development, our own administrator, Ms. Heather Karoof, other administrators, staff of the Division of Health and Social Services, and of course of the Tobago House Assembly. Let me, of course, recognize the chairman of the board, other members of the board, the CEO, and other senior staff and staff of the Tobago Regional Health Authority, especially invited guests, members of the media. Ladies and gentlemen, I thank you. Let me begin on a very personal note. I count myself very fortunate to have been part of this process for two reasons. One, I spent many summer holidays from 8 till 4 at the old Scarborough Health Center because my mother worked in the health center for 33 and a third years, and many a time I have to go to work with her. And when I looked at the transition from what that was and what we are today, I think we must give ourselves a round of applause that is an indication of progress. But more importantly, ladies and gentlemen, I have no background in health, more than I know that I need to be aware of my health and my status and my wellness. But having the opportunity to work alongside on this committee with different persons, clinicians, technocrats, and technical persons, for me, it was indeed an enlightening and educational experience. But more importantly, what I felt it said, and it sent a signal for all of us, is that when policymakers, politicians, technocrats, technical people, and clinicians get together, this is what we produce. And this, I think, we can and should be replicating in other areas of the Assembly. By that kind of collaboration, that we understand what our roles are at the different levels, and by putting our heads together, we can achieve objectives like this. This project, ladies and gentlemen, is a true testimony to the resilience of the people who work in the THA and to Tobagonians. Many a time, I'm sure, that persons and called it on the radio, meet you on the roadside, even sometimes staff would wonder if we would ever come to this day. And I want to, of course, in his absence, commend the Secretary, Mr. Albert Pilgrim, for the vision that he had to, of course, establish a steering committee to commission the health centers, because that was the first step in seeking to arrest the challenge of getting this project to this point. Because we have always said as administration, ladies and gentlemen, we are about finding solutions to problems. And Mr. Pilgrim, in his foresight, felt that there was need for a committee to commission, firstly, the Scarborough Health Centers, and then the other health centers that we were working on, Charlottesville, and thereafter. But ladies and gentlemen, many times we were challenged with how do we manage these circumstances? Can we get past this point? And this here, ladies and gentlemen, is a testimony to that resilience. Is a testimony to the vision of incorporating dialysis into a primary care facility. It is a testament to how, as a people and as an assembly, we can, with the right vision, the right resources, make things happen for the people of Tobago. So I want to commend the people who are not up here on this side today, but all those persons in the task force, all the persons who would have been responsible, the clinicians, the cleaners, everybody who along the way, the contractors, the laborers, all along the way would have ensured that today we have this building, but tomorrow we continue to have new services that will indeed enhance the lives of Tobagonians. Ladies and gentlemen, you would have heard lots of numbers this morning, very significant numbers in terms of some of the things that the Assembly is doing with regards to healthcare. But while all of those numbers, as comparison to ourselves that we're doing with other RHAs, are important, when it comes to health, the most important number is yourself. And this initiative will be of no use if, as a people, if as an individual, you do not access it. Because, ladies and gentlemen, healthcare is a partnership. It is the responsibility of the Tobago House of Assembly, led by the Honorable Chief Secretary, to set the policy directive. It is the responsibility of the TRHA to implement those policies. But it is your responsibility, ladies and gentlemen, to ensure that you see about your own personal wellness. Because at the end of the day, if you don't, all of these massive primary care facilities and these primary care initiatives that we are putting on behalf will not come to any fruition if you are unhealthy, if you are not taking care of your own wellness. So that at the end of the day, ladies and gentlemen, the most important number in this equation is yourself and your own wellness, as we seek to partner in the delivery of health care for the people of Tobago. Ladies and gentlemen, lastly, I want to say that this building, this facility and the services there must serve as a motivation for a number of persons. Motivation for our clinicians who recognize that the opportunity that they have now, and I think the administrator alluded to it, in that compared to the pioneers and the Scarborough Health Center as it was before, even the one before that, where it may not have been, the space would not have been so large, and the services and the ability to extend the services was not so technologically driven. All of those things happen today. And this, therefore, for the persons who are working here must serve as a motivation for you to ensure that you offer the kinds of service and the kind of attitude that is second to none. People must feel that there's a difference when they come to this health center. They must feel that there's a difference when they interact with each and every one of the person. From the time they reach here with the security until they leave, they must feel that there's a difference, and they can see that there's a difference in how we are administering and how we are delivering healthcare. Additionally, ladies and gentlemen, this must serve, obviously, as a motivation to us as policymakers, administrators, that as we watch how we can, having the right vision and in combination with the appropriate level of resources, what we can do here in Tobago, that all is possible. Ladies and gentlemen, we have a situation here where the number of dialysis chairs here are comparable to what exists in Trinidad. But more importantly, there's a situation here where we have a dialysis chair for persons with infectious diseases for the whole of Tobago, whereas there's one for Trinidad alone. And I'm saying this is as a result of the vision of the Executive Council and the Tobago House Assembly and the management skills of the TRHA to ensure that today is possible. But as Mr. Frederick said in his prayer, today is history. Tomorrow is what we have. And ladies and gentlemen, tomorrow as we serve, as we continue to serve members of the public in this facility, we ask you as the clinicians to continue to give your 100%. We ask you as members of the public to continue to utilize this service because it is the only way we can measure and truly chart our progress. Ladies and gentlemen, I thank you. Enjoy it.